have before us. And I was reminded of a song from the Civil Rights Movement, "We Shall Not Be Moved." We shall not be moved. We shall not be moved, just like a tree that's standing by the water. We shall not be moved. We must hold the line. We shall not be moved. 30 years ago, I was sitting in the office of our gay student group reading the first news reports of a disease that was killing young gay men. I was sitting in a room with many young gay men. We didn't know what the disease was. We didn't know what caused it. We only knew that it was scary, that it was killing people like us, and that it was polarizing communities. At the time, we didn't know anyone who was infected. None of our friends had gotten sick. No one had died. Flash forward to 30 years later, we had a reunion last October, and in our detective work to track down our old friends, we discovered that 4 of our dear friends had fallen to HIV and AIDS, and many others were infected with HIV. All of us here today remember those fallen warriors who touched our lives, our friends, lovers, family members, people we knew and loved, and people whose spirits we carry with us now. Ari Gonzalez, my classmate. Ron Lindsay, who was co-founder of the Middlesex County AIDS Buddy Network in the late 80s. Frank, Larry, Marlene, and others who founded the Connecticut Positive Action Coalition. And my good friend Keith Kyler, who founded Housing Works in New York, and so many more. Despite all of those tremendous losses, all of these friends continue to inform and inspire me still, as do you. From Jump Street, it was people living with HIV and AIDS, gay men and lesbians, and a handful of allies who pushed the edge of the envelope to make things happen. You fought for HIV prevention, care, housing, and syringe exchange. And 30 years later, it's still true. You continue to be the motivating force behind and in front of everything. From the days I was reading those early reports to this very moment, this has been a deeply personal fight for me. Governor Rell's budget calls for draconian cuts to AIDS prevention and syringe exchange, which would send us back to funding levels from a decade ago. Those cuts and those other cuts proposed to health care and supportive housing will cause irreparable harm to many of our state's most vulnerable and medically and socially fragile people, including people living with HIV and AIDS. She's proposing this at a time when the number of people living with HIV and AIDS has doubled in the last decade.
That's right.
The budget that she proposed calls for slashing HIV prevention and syringe exchange by 30%. accomplished so far. Connecticut's syringe exchange programs were once viewed as a national model. The cuts wouldn't just symbolize the erosion of access, but perhaps more simply put, these cuts will result in the decimation of any semblance of good public health policy on HIV in the state. Today is the day to tell your legislators that we need them to do more than care about us. We need them to do more than support us. We need them to do more than listen to us. We need them to act. We need them to be champions with us and to fight long and hard for the funds and services we so desperately need. We have some angels here who have been quietly fighting for us. And to those angels we say thank you. When you meet with them, you need to thank them for supporting us in the past and now. We need to support them for doing the right thing. We need to thank them for supporting us during this very difficult time. I'm calling all you once again to urge your legislators to stave off these cuts, to ensure that people with HIV and AIDS, that families, that poor people, that the elderly and people with disabilities aren't thrown in the dreadful abyss of neglect. Again, we must hold the line. We shall not be moved. There are revenue enhancements and other choices that can be made. Policymakers are refusing to add costs to the most wealthy, but they've already approved bigger, more devastating burdens on those with the least resources in our state. We cannot afford to continue down this path. 30 years later, our struggle continues. Once again, we are the leaders of our own destiny. We are the ones who are leading the